Hi, my name is Fiona Robbins, and I'm turning 26 in June, which means I'm not going to be on my parents' health care anymore, and I'm wondering what affordable options I will have.
Thanks for that question, Fiona. I don't blame you for being worried, and I hope you do have affordable options. I was really proud in my first term in Congress when we passed the Affordable Care Act, because one of the things it did was it allowed people to stay on their parents' health care until they were 26, which gave young people coming out of college a lot more time to find a job, to find their own health care coverage. It also had a lot of other provisions, like making sure that if you had a pre-existing condition, you had to be covered. Unfortunately, for the last several years, the Republicans in Congress and this president have done everything they can to erode the protections in the Affordable Care Act. We need to build that back up again. And we need to make sure that the subsidies that we originally provided so that health care would be affordable for people and employers could cover the cost of covering their employees, we got to get those back there and make sure that they're available to people like you so there will be affordable options. One of the challenges here in Maine is we've had a governor who's continued to block the expansion of Medicaid, which also would cover a great number of people who just don't make enough to cover expensive health care. I've been fighting very hard to make sure that the governor actually has to put that back in there, and we're hoping that because the public has passed that at a referendum, that we can actually get that coverage for you too. I also think if we get a new majority in Congress, the Democrats are back, we'll fix some of the problems with the Affordable Care Act, and we'll start talking about things like Medicare for All, a real expansion, or a public option, so there's more competition out there. There's a lot more we could do, and I hope we can provide those solutions to you.